Now at 5 o'clock, we could be just weeks away from the first FDA-approved home treatment for COVID patients.
That's right.
Drug maker Merck has asked the federal agency to authorize a coronavirus treatment pill for emergency use.
Clinical trials have shown it helped save lives. Merck says the treatment can reduce the risk of hospitalization or death from COVID by 50%. That number comes from a study involving 700 patients. After a month of treatment, just over 7% of people receiving the drug were hospitalized. Merck has already sold 1.7 million treatment courses to the U.S. government.
Well, Dr. Suman Radhakrishna joins us live to talk about this promising pill. Welcome, doctor. First question, what will the FDA be looking at as the agency decides whether or not to authorize this pill?
First of all, thank you for having me. So the process that goes through in the FDA is whenever a company submits for an emergency use authorization or a regular authorization, there are physicians, statisticians, scientists, chemists, pharmacists who go through and break down every portion of the data that is there, so they can bring up questions and satisfy the requirements of safety, satisfy the requirements that this drug is actually effective and not just a dummy pill, before they can come back and say, recommend to the FDA and say, yes, this is worth approving.
So, doctor, once it's authorized, how soon could the pill be prescribed? Would patients go to their regular doctor or have to see a specialist for this prescription?
Well, emergency use authorization usually allows physicians to prescribe. It comes, there is also the guidelines that the FDA will, in addition to authorizing, will give us in the sense of who is eligible, what kind of tests need to be done before you can prescribe this medication, what are the side effects to look out for, and also the data to the patient in terms of what they should be monitoring in terms of adverse events, improvement, and so on and so forth.
Well, probably an important piece of this, doctor, is what should the pill be used for? Should people still get vaccinated once the pill is given the green light?
The thing is this, the vaccination prevents you from getting an infection if you're exposed. So this is even before you're exposed. This is that, that first step. The second step is, if somebody is exposed, then you worry about possibly preventing the infection. If they are symptomatic, then you want to prevent them from getting serious disease, and that's where this pill comes into play.
All right. Well, Dr. Suman Radhakrishna, we thank you so much for joining us this evening.
Thank you.
For more on Merck's